stability. Fulfillment means safety, relationship, happiness, control, family, peace, work, necessity, better productivity, keeps me sane. I agree on that. Protection, mental illness is serious, allows me to function, well-being, stress-free, peace. And if you see the middle word is peace, the words that have been mentioned the most will be there in the middle. So peace is an important word. Let me see if something more will happen. People are able to connect to Mandela. If you want to have the code again, it's 810271. Yeah, wow. Contentment, full clarity. I read with others, determines how I am, peaceful, serenity, enjoyment, to be sound of mind. Wow. So the words that are lighting up the most, these are the words that we mention the most. So happiness, peace, stability, health, sanity, focus, joy. And why I put this here is, like I said, it's also important to see if you want to set a goal or you want to work towards something, that it's based on something positive. You know, our mind cannot deal with the word not, because if you, for example, think of, you don't think about a pink elephant, then what will happen is the pink elephant will happen in your mind. So the more you can focus on the positive sides, the more, yeah, your well-being will go in the direction that you want. So I will stop share now. It will go on. You can still give the words. At the end of the presentation, I will come back to this to see what happens, if it's more. I will go back to the presentation. What I also want you to ask is, if you have questions, I will get there. So first I will do the presentation, and then afterwards you can ask me any question that you like, and see what comes up. So if you talk about mental health, and of course I work a lot in coaching, and I see a lot of people, and also in my trainings, and from what I discuss with my clients, or what I see happening, or I discuss with my colleagues, is that there can be several outings that can be seen, or you can feel. For example, you can have stress, you can have anxiety, you can have pressure, you can feel pressure. There can be negative or chaotic thoughts in your mind that keep on going, mood swings. These are all things that can happen if you are under stress and you feel under pressure. So like Purvi also introduced me, I'm an NLP international trainer. And the funny thing is, when I do NLP and I tell them it's Neuro-Linguistic Programming, the first question I get is, oh, so you are in IT, so you do programming of computers. Well, that's not the case. You can see, if you see yourself as a computer, then what I do is, and what NLP does, is it looks at your patterns, like how did you store what in your mind, or in your subconscious mind, actually. So neuro is referring to the senses, because that is the way we perceive. Linguistic, because that's the way we express ourselves, as well verbal as non-verbal. And programming is the way you have stored things in your mind. So this is like a definition of NLP that you will find also when you Google it. On Google, yeah, of course, Google has a lot of information, of course. So the beauty and why I fell so in love with NLP and with coaching and with training is that with NLP, we explore how you can change from within. A lot of times we blame the outside world for what's happening to us. It's because of my husband, I cannot do my work well. It's because of my father, I have stress. It's about the pandemic that I cannot do my work well. And of course, that is the first instinct, the human behavior that we have. Yet, the beauty from NLP is that everything that is external, we bring internal. So one of the biggest questions that we ask with NLP is, how can you influence your internal states, not focusing on the outside world? Because the thing is, the outside world you cannot change. It's like a remote control, you know? You cannot push a remote control to other people and hope they will change. They will not. So the only one that you can influence, that is yourself. So to explore what's happening in your mind, or for example, when you have stress or you have anxiety and you're going to explore what is going inside of you that makes you the driver of your own bus again and makes you able to connect to possibilities, because NLP is a kind of positive psychology whereby we want to see how can we reframe things and to put it in a different perspective so that you can handle it again, so that you can make steps forward again. Connected to the heart, because that's for me the most important thing, and probably knows that as well, is if you cannot connect to your heart and you cannot work from your heart, and I know that you all work with children, so there must be a very big love inside of you. If you cannot work from your heart, then I always question what are you doing? Because for me, that is really connecting to humanity as well. NLP has a lot of presuppositions, and one of them, and I think that is also one that you as dentists will like to hear, is body and mind are connected. And I think also you notice when you work with a child, when they have in their mind that they don't want to open their mouth, they will not open their mouth. So there's a big connection between how body and mind are reacting. And also that is also, if you look at stress, that's also the case. Because if you look at the definition of stress, it's a form of tension in your body as a reaction to a trigger that happens around you. And like we say in NLP, if there is a trigger, and the trigger can be something that we all react differently to. It doesn't mean that if the pandemic is there, you see everybody is reacting in a different way. And that has also to do with our filters, how we are perceiving the world and how are we communicating. So, for example, if there's a trigger, it goes to all kind of filters through our minds. Like we generalize information, we delete information, we distort information, we react towards things based upon how we have been raised, how our culture is, our memories, our decisions that we have made. So a trigger and how we respond to it is for everybody different. There's nobody that I know that is reacting in the same way to stress, because we all live our lives, we all have our backpack, and our backpacks are filled with different things. So in NLP, we say like there's a trigger, then there's a thought about it, you start to think about it, then there's a feeling, and then you see behavior. So in our daily life, we see triggers and behavior, but a lot of times we don't realize what's going on in somebody's mind. And that's the same thing also with stress. There is a trigger that makes you think in a certain way, it makes you feel in a certain way, and then you behave. And usually these are also things that are conditioned. It's something that you have learned, or something happened in your past that brings you back to that memory that you have and react in a certain way. So that's why we say in NLP, if you can do your inner work, you can look inside of yourself how you can change that. that is the most powerful decision for yourself and most powerful change that you can make for yourself. Then to let it overflow or to let it overtake you and to overwhelm you. So I said, like, there's a different body and mind and connected. So I have some tips to work with your mind and some tips to work with your body in order to see how can you practically work with that, because that is one of the beauties also of NLP, is that there's a lot of tools that are very practical that you actually can instantly change something in your mind. The first one is tip that I want to give you is take distance from your thoughts. And in NLP, we call that association and dissociation. When you are associated, so you feel everything around you, then of course everything can become a blur, especially when you are stressed. You can feel that emotions are going to overwhelm you. So it can help to look at your thoughts from a different perspective. And of course, you have to first become aware of your thoughts, because that is the first step. And from there, you can take a helicopter view and ask yourself, which tip can I give myself? Or when you are home and you feel like, yeah, I reacted in a way that really stressed me out, and you can reflect on it, because in the moment itself, it's of course very difficult. And in the moment itself, it's only for me, what I see, and I worked, for example, with last year was a terrorist attack in the Dusit Hotel, and I worked with the staff of the Dusit on the stress. And of course, in the moment itself, when something happens, you cannot take a helicopter view. That's not possible. Then it's very necessary to feel what you feel and to think what you think. It's all part of processing, because our human system is actually designed to deal with stress or to deal with negative thoughts or to deal with whatever comes your way. So you also have to give yourself a chance to touch your inner healing, or to be patient with yourself. So to take the helicopter view and to take a look at yourself, for example, to visualize yourself on a chair across you and say, okay, so now what tip or what feedback can I give myself in order to do this differently? It's already something that you can take a step back from the thoughts that are happening to you. Thoughts are like clouds; they come and they go, and they get meaning when you give meaning and when you pull them inside of yourself. So the more you can view your thoughts, the more easier it will get. Another thing on thoughts is to investigate your thoughts. And this one I like really very much, because sometimes you can have thoughts that they're not helping. And I think you will also recognize that negative thoughts can bring you in a spiral down and will not help you to actually deal with the situation it is. So maybe some of you know her, Byron Katie. If you are interested, she has a 4-question model. And this is the question that she asks. So if there is a thought, you can ask yourself, is this true? Is this thought true? And is this thought 100% true? And what will happen if you hold on to this thought? And is there a good reason to hold on to this thought? And who would you be without this thought? And I know from experience that this set of questions can help you to detach your thoughts and detach from a negative thought, or detach from when you are experiencing stress. Byron Katie herself, she developed this through her depression, and she was blaming everybody outside of herself and was not looking at herself. So at one point, she came up with this question, and she was like, yeah, actually, I cannot blame anyone but me for what I'm thinking. Nobody can influence my thoughts except me. So this is very powerful. And that's why I also want to share this with you. Another thing that can help is visualizations. And I mentioned this short. I wish I would have like a whole day with you to explain things. So I hope it will be clear, but to visualize can help you in order to take your mind to a different place. And to, I always say, like, if you put things in future, like if you make a picture about how you would like to work or how you would like to handle your stress, and you create that picture in your mind, and you add the colors you like, and you add sounds that you like, and you add feeling that you like, then actually you can create something very powerful for yourself. And to use these visualizations, they can really help in bringing your mind to a different thought, to bring yourself in a different space so that you can react from a different space, because I think in mental health is very important. Another one is building resilience. Oh, Purvi, hi. It's almost time. Building resilience. So to adapt to what is, that is very important, I think. And I think a lot of you already can do that because also what you see in your work, and especially also people who work in the community, yeah, the stories that you hear, you have to realize that you cannot change. And if you want to change, the first step is to accept that what is, you know, we cannot change this pandemic. We cannot change the rules that the government makes. And it can be very frustrating. Like me in the beginning of the pandemic, like I'm Dutch, and I wanted to travel to the Netherlands. My ticket was cancelled. That gave me in the beginning a lot of stress, like to realize that borders were closed. I have 2 children who are schooling in the Netherlands, so that means that I am here and my kids are there. 2 of them, as one of them is here, the baby. But it was really stress, and I knew that I cannot change it. There's nothing in me. I cannot call the president and say, "Hey, you have to open up because I need to go." That is not the case. So to sit with what is was one of my biggest, biggest help in order to build resilience for myself and to have compassion with myself. You know, we can also be so hard on ourselves. So more compassion for yourself is also something that can help. It also will build on the resilience. The last tip on the mind is finding out where the trigger originates from, because I always say behavior or anxiety or negative thoughts are straight from the air like that. They have a root somewhere in our subconscious mind, or what we have experienced in our life. So once you have detected that, you can work with that. We cannot change what happens. I cannot change that a pandemic happens, but we can look and how we can change the perspective on that, on how you handle that. And I also want to urge you, if you have severe thoughts or severe anxiety or severe stress, look for help. Because I know there's a lot of times there's a taboo on mental health and seeking for help. But actually, if you really feel that, look for help. Look for a specialist who can help you, because that will also give you relief, although you can do a lot by yourself. Also, you can do a lot of things with your body. First of all, become aware of what you feel in your body. What are sensations that you feel? So listen to the signs of your body and act on it. If you're tired, you know, feel what you need. Feel what you then want to do. So rest and relaxation to recharge your battery in these times is very extremely important as well. Like I had a intervision this morning with my colleagues, and I made a promise to myself that every week I block out 1.5 days in order to really feel, do I want to work Or do I want to sit on the couch with my daughter? Or do I want to go for a coffee? Because luckily we can now go for a coffee. At least Java Junction is open, so I'm very happy about that. But what do I need to recharge my battery? Because you need to take your mind, especially in stressful times, you need to take your mind off what's stressing you, to get yourself in a different perspective, to get yourself in a different space. So breathing or mindfulness or meditation, to connect through your body to your own source, to your own inner wisdom, to the silence within, is something else that you can do, and it will help you. I know a lot of people who are meditating, or taking walks, or doing breathing exercises in order to find the balance between the relaxation and the times that you feel stressed. Yeah, this is actually the presentation that I had. I just want to see, I will go back to the word clouds. Let me see, School's technique, to see if we have how it looks like now. It looks like this now. So in the middle is peace. And I think if it comes to feeling stress, then feeling at peace is at least what you think is the most important thing. And I think it's very important that you find out and figure out how to achieve that peace for yourself. What steps can you take? What can you do yourself in order to connect to your inner peace, to feel calmness? How do you recharge your battery? And don't be afraid to ask for help, because that is also very human. If you look at the Ubuntu principle, it's like I acknowledge my humanity because you are humanity, and I am because you are. We cannot do without each other, and especially in this abnormal times, it's good to reach out, because all that I've said now, and what also can help is just to have a talk with your best friends, or with a colleague, or with your husband, or with your wife, or who is there, just to have a talk and a coffee, because sometimes also the only thing you need is a very good, it's an ear to listen, and to release what's inside of you. Because, you know, when you're going to suppress emotions, it's like a ball that you keep under the water. And at one point, the ball wants to come up. And the longer you keep it under the water, the more it will come up with force. So the more you can express yourself and to talk about what's going on in your mind, and what's keeping you busy, or what is giving you stress, that is one of the most important things you can do. And to check on your colleagues. Like I do regularly, or my coaches or the trainers, or like, hey, how are you? Just to drop the message that we can feel that we are not alone in this world, and we are not alone experiencing what we are now going through. So, where is it? Yeah. I've come to the end of my presentation, because I also didn't want to share too much. I can talk for hours, so Purvi knows that. Which I will do not. So I would like to know if there are questions.
So Marianne, we do
yes.
have a few questions, and I'll take them one by one. The first one is asking, what is your experience about the success of meditation?
Success of meditation. What I do know about meditation is when you can silence your mind, when you can take your mind off the thoughts that you have, it helps you in achieving clarity. And I have, you know, there's a lot of way of meditation, by the way. Yeah? It's not, meditation is not only sitting on a yoga mat and having your fingers like this. It can also be a walk that you take, or it can be listening to your favorite music, or baking a cake, or having fun with your family. You know, meditation can have a lot of there are a lot of forms. And what I do know, if you take time for yourself and you focus on your inner self, that really helps. Though if you have severe stress, then I also suggest that you first find somebody to talk to, because also your thoughts can take a walk with you. So it's important to find that balance. But meditation is for me really something that at least also helps me in order to keep my mind healthy and to be resilient. Yeah, to build resilience in myself.
The next question I have is from Dr. Stella Kubasu. She says, thank you for a great presentation. In therapy, the ABCDE seems to work very well. You haven't touched on this in your presentation.
I don't know what the ABCDE is. You know, there's
Maybe
a lot of ways. Yeah, there's a lot of ways of dealing with mental health and with stress. And there's a lot of, there's a lot of therapies and a lot of ways of seeing this world. So if that works, ABCDE, then please use it. NLP also says, like, if it works, use it. If it doesn't work, then change your strategy, do something else. Because if you always will do what you always have done, you will always get what you always have got. I cannot repeat that, but that's very important. But and some people will fit into NLP, some people fit in other methods. As long as it fits you, that is the most important thing. Did she say what ABCD is?
We shall find out in a minute about that. We'll come back to it in a minute.
I'm curious. Yeah.
And I think this is quite relevant, that healthcare workers, one of the stresses that we have, healthcare workers fear getting infected while working. How do we deal with this reality that we have to go into every day?
Yes. Yeah. First of all, I cannot even imagine what it is to be a frontline worker and to be so fearful for infection, because I'm not on the front line, so I cannot. Yeah, I can only make a picture of that. And what I can imagine is, first of all, is to protect your well in a physical way. And the second of all is to, like I said, to question your thoughts. Like the thoughts that come into your mind, if they are true and if they are helping, or if they are blocking you. And to become aware of that kind of thoughts, I think that's very important to deal with what is. But first of all, my deepest respect for you, because I even don't have words for it in that sense. But I think questioning your thoughts, like, are these thoughts relevant? Are they in proportion, or is this sparking anxiety? And like I said, it was really becoming too much, because like this is a very short presentation. Look for help. Look for somebody who can look with you what is exactly happening inside of your mind, and how can you become stronger.
Thank you. I know that's a difficult one for you. It's a stress that, and I think from my personal experience, I'll say that sometimes I think it's very easy in our mind to build mountains of worries when, I think just doing what we physically need to do and trusting that what we're doing is going to keep us safe is what we need to focus on. I'm just going to go back to the ABC. Yes. Because I think there is very similar aspects in NLP. I think it's just different terminology. A means activate. So something happens to or around someone. The B is the belief. The event causes the belief, whether it's rational or irrational. C is the consequence. That belief leads to a consequence, which can be, again, rational or irrational. D is disputation. If one has held the irrational belief, then they must dispute that belief and turn it into a rational belief. And E is the new effect at the end of it. So it's a whole cycle of change?
It's the same. Like, it's different terminology, but like the trigger, the thought, the feeling, the behavior. I just touched there because otherwise it becomes too technical. I didn't want to become too technical, but if you look deeper into the communication model, then this is what it is. The ABCDE. Yeah. So thank you for sharing that with us.
I think it's different terminologies for very similar processes.
Yes.
The next question, and I think this one is a very good one, is what are the signs and signals to look out for to establish that you are stressed or burning out?
Yes. What is important to notice is your body, because your body will never lie. If you feel like you're going into overdrive with your thoughts, if you feel tension in your body, if you feel how do you say that? If you notice that your thoughts are really going to take over the way you are thinking, it sounds a bit strange, but sometimes, you know, things just happen. If you feel that you are reactive, so that something happens and you just immediately give a reaction. If you notice you become like short-tempered, or you say short-tempered, is that the word? If you become tempered, like something happens and you are, yeah, how you say, you cannot handle things anymore, or you're going to shout, or you're going to, normally you're very kind, but you cannot be kind anymore. These are all signals that are in you, and it can be very subtle, especially the ones in your body. So what I really want to urge you is to become aware of how does my body feel, what's happening inside of me, and what are my thought processes, because from my experience, people who are stressed, they recognize that, because things, you cannot react normal anymore on things that should be very easy. So that is actually how you can recognize it. Yeah, that's what I would say.
The questions are really flowing in now. This one, I'm going to read it. I want to know your thoughts, but it says, during this pandemic period, I'm unable to give the best treatment to my patients, especially as we are meant to avoid treatments which involve aerosol. I feel stressed as a result of this. How can I resolve this?
Yeah, my question is that true? Because this, in the sense of course, like you have to deal with what is, and you want to do the best for your patients, right? And that is following your heart, and that is like giving it all from your passion. And if that's not possible, then it must be very hard. So I want to say to you, you are enough. You know, the fact that you show up in this period of time for your clients, you are enough. And I can imagine it gives stress, because you want to give the best that you have. The only thing is we have to see what is possible with the things that are available for now. And I think that is something that you need to accept, how hard it is, because acceptance is also not done like this. It's like a process. So allow yourself time and allow yourself to be with what is. And again, I want to say to you, you are enough. You are already, yeah. You know, we cannot, if the government says you cannot do this or that, and you have to stick to that, that is not your fault, because this is an external factor that you have to deal with. But then you can do, as long as you do everything with the positive intention, and you do with the best intention that you have, then that's all that you can do.
Great. I think that summed it up. I think we just need to know that what we are doing, as long as we do it coming from the right place and with the best interest of the patient in mind, even though we can't do everything at the moment, we're doing our best, and that has to be enough for now.
Yes, yes.
The next question is from Dr. Ahmed Ali. Thank you for the great presentation. My question is, how do you balance being focused and disciplined on your work by doing what you should when you should do it, whether you like it or not? Especially when you don't like the situation, when should you stop?
Wow, yeah. First on the word balance, because balance, like a perfect balance, will never be there. That's what I believe, because that's nearly impossible. Because the minute that something else happens, things will you have to find a new balance. So to find your balance every time again is of course a big challenge. If there are things that you question your thoughts also on that. Especially on the part that brings you into disbalance. Explore what is actually happening to you when you have to do that, or where does it come from, where does it originate from, or like the B, what kind of hindering belief did you build on that, and is that belief true? And I think when you stay honest to yourself and you keep on exploring what you're thinking, and to question also your own behavior, why do you do what you do? And I think you find every time a new balance.
Yes,
Yeah.
I think I agree with you, and I think it's also about, you know, finding your little purposes to get to your big purpose. And I think the more you follow your purpose, the more you feel in balance. So the thing is to question yourselves all the time. And if something doesn't feel right, or if you feel like you don't like the situation, then I think questioning it will lead to answers.
Yes. And take small steps. Don't go like whoop, like, you know, to walk to Rome also starts with the first step. So break it down for yourself. Don't go too far in your head, because it also can be stressful.
So I'm going to join two questions because I think they're quite related. There's one which says, what are the signs and symptoms of the mildest mental disorder? And then someone is asking, what's the difference between stress and depression? So I think this kind of covers the whole mental health area. If you could answer those.
Yeah. The difference between stress and depression, I think stress is like can happen in the momentum. So now I'm not so stressed, but for example, if now I don't know, the Wi-Fi goes, then trust me, I will be stressed because I'm in a meeting and the Wi-Fi is gone. So stress can be also something sudden related. I think depression from repeatedly negative thoughts, and I think that stress can be an underlying issue or underlying cause to slip into depression later on, because depression has there's too short time to dive into that, but there's a lot of specifics also to depression. Which I always refer to, actually, your body is asking, your mind is asking for a deep rest for yourself. What's happening? What is happening in your mind? And give yourself a break. So the mildest disorders, that for me, it's difficult to answer because I don't like to put labels on people. That's what I always try to avoid. So if it comes to disorders, or mild disorders, or the beginning of a disorder, or you want to recognize it, then I always say, like, find a specialist. But then also the question is it true? Because I also sometimes know that we label people just so that we can handle them. But for me, as a coach and as the therapist I am, I will always look into, so what happens that sparked this behavior? What is the underlying cause? And if it's something that is from body processes, of course, then you can see which disorder it is. But sometimes it's also something that happens in the mind, or is happening because you have experienced something. So I'm always very cautious with putting these names on, on people or on what's happening with people. But I strongly believe that stress can lead to depression if you don't handle your stress. Yeah.
Thank you. I think this one, it's an interesting question. It says, and I think a lot of us feel this, is that the problem for healthcare workers is we are always expected to deliver and kind of deliver the best. And for a lot of us, this means that we are under stress. At the
Yeah.
same, we feel that no one is taking care of our well-being, and therefore a lot of us end up in burnout unless we discover this early and unless we have help of colleagues. What is your advice about this?
Yeah. Well, I think mental health, and it doesn't matter, of course, when you are a healthcare worker, of course you are under pressure because people expect the best of you. In the Netherlands, I worked with a hospital with the nurses, and we trained them on how to have conversations with each other, so that you keep an eye on each other. Like you, when you are colleagues, when I see my colleague acting and I think, what's going on here? Or she's talking a lot, or she's very nervous, then I feel it as my responsibility to ask her, so, hey, are you okay? Or can we talk about it? So I think that you're right, that the focus on mental health for healthcare workers is something like it's almost not there. Yet I think you are the ones who need it the most to offload your stories, what you have experienced, or to find support with each other, or to have the ability or the possibility to seek guidance if you feel like, okay, this stress is becoming too much now. So yeah, for now, practically, and to keep it small, keep an eye on your colleagues and ask them, how are you? How are you today? And I'm not, because that's a question that you have to ask, because how are you? You're fine, because that is usually what happens in the whole way. But a truly question, like, how are you? And to create time for that. And I know that time pressure is a lot, and maybe you don't feel like that there's time to do that. Yet I think it's very important, especially in this time, to keep an eye on each other.
Thank you for that, Marianne. And I would just like to add there, and I think this is something also very dear to your heart. I think the more we connect to each other, the more we communicate with each other, the more we connect to each other from the heart, we will actually get the answers. And communication, talking, sometimes, when you're stressed or when you're feeling worried, just taking the time to talk to someone about it just relieves a lot of that tension, a lot of that stress. So it's a lot of it about connections, communications, and as Marianne, you've said, feeling inside ourselves, like, learning to listen to our body, learning to listen, okay, why is this hurting, or why does this feel different? And then taking it from there. I would just, one of the doctors has given a really nice comment, and I think, again, for me, it is about the fact that we need to start conversations, we need to start connections, because mental health, unfortunately, is a taboo to talk about in most cultures, but especially in Kenya, especially in the Kenyan culture. She's clearly written here, mental health therapy may be helpful, though in our Kenyan culture, we only go to the therapist if we are mad, and she said, and I think she's really summarized it in saying, you had talked of triggers in our current scenario. This is the comment from Dr. Stella Kubasu again. You had talked of triggers in our current scenario, COVID-19 in terms of triggers, is like a volcano about to explode. And the presentation is saying that, yes, we need to take that personal responsibility for self-care, both physically, emotionally, socially, and spiritually. And that's going to be the best way to handle this. But I think
Yes.
the other way to handle this is to not, even though we may not be able to see our communities, just still keeping in touch with them and keeping those connections going as well. Do you
Yes.
agree?
Yeah,
Okay.
because like imagine that there is like 10% more connection than there is now. Imagine just to go in small steps. Imagine what that already will do for you to feel community, or for you to feel like, hey, I'm part of something, I'm not alone here. Because that is what this pandemic can do easily, that you feel isolated. Yet you can reach out, you know, we have Zoom, and we have sometimes Wi-Fi, KPLC willing. So that's really something that you can make use of in the circumstances that we are in now. So thank you for the summary. It was a very nice summarize. Thank you.
There is one more question and then a couple of comments.
Yes.
So this is coming from a dentist in Nigeria. It says, in Nigeria, due to the enormous stressful triggers that the general populace is subjected to, one can hardly relate his body changes to mental health abnormalities, probably partly because of lack of proper awareness. So my question is, how else can we establish elevated stress levels in ourselves in order to know how to better deal with it? If we're not able to read our body, or if we don't understand it, what other trigger things can we see that might direct us to the fact that they stress?
Yes, your thoughts. The thoughts, everybody has thoughts. There's nobody who has no thoughts. The only thing is, and I also know from African cultures, I put it broad now, is that something to express what you're thinking is of course something else. So you will experience when you have stress. You can see it in behavior of people. You can really. My daughter also has stress now because she wants to go to me. She thinks now it's been enough. Mama is mine. But you can actually, if you look at stress, you can see it from somebody and you have thoughts. So the courage to start conversations that matter is another thing I want to encourage. Because if we don't start the conversation, it will stay inside of the body and things will happen. So don't be afraid to start meaningful conversations and to ask the question that needs to be asked if you see somebody in distress, because you see it. We all know it. And especially you dentists, you see people in stress almost daily, like, oh, I need to go to the dentist. So to mention what you see and to name what you see is a very important aspect of that. So I still will say, start conversations. Do it. Don't be afraid. It's okay.
Okay. Marianne, before I go to the last two comments, is there any maybe like sort of a quick exercise or something that you can recommend for us, like maybe some sort of breathing or movement or something, which can take 2 or 3 minutes if we're stressed in the office, that we can do, that you can share with us, that everyone can easily do to try and just reduce their stress levels in that moment?
Yes. What you can do is what I call the open heart breathing. And that what you can do is to put your hands on your heart, around your heart area. And to take, yes. And to take a deep breath, and you're going to count your inhale and exhale. So you do 5 seconds inhale and 5 seconds exhale. And 5 seconds inhale and 5 seconds exhale. And then what I want you to do is to think about someone or somebody that you really love, that you feel so much love for. And that feeling, I want you to expand to where your heart area is. And while you keep breathing, I want you, with this feeling, to like breathe through your heart, as if the breath comes through your heart. And I know while you are breathing and while you feel connected to that feeling of full love, you can feel the love in yourself, and you can actually feel that your body is coming down. So that's what you can do. If you want, I can make a write-up about that. I don't, to see how you can get it to people, but that's something that you really can do. And that helps me also a lot because it brings me instantly back to myself. Instead of being focused on what's happening around me, I go back to myself because the only one I can have influence on is myself.
That's that a write-up would be great to share with everyone, because I think just this is such a quick exercise and you immediately just feel that calmness within yourself. I hope that all of you who tried it right now with Marianne felt that. Dr. Neha Shah has made a really important point, and she says, I think it is very important for us to look after our own mental health, as a lot of our patients currently will be offloading their fears and their stresses on us, especially in the current situation. So we need to look after ourselves. And the other comment that has come is that COVID has taught us that healthcare workers need to incorporate counseling or mental health work in our management. So I think it is really important, because one of the other comments says, I think mental health is stigmatized, and that might be the reason healthcare workers shy away from it. But as healthcare workers,
Yeah.
we are the ones who can see it and recognize it, and we are the ones who are in a position to start these conversations. So I think it's very important that we do that for our own mental health and that of our patients as well. And lastly, a great comment from one of the doctors, Dr. Nicholas Wambugu, and I agree with this, that in another way of reducing stress, in as you've said, is to use our bodies, and doing yoga stretches is a wonderful way of reducing stress. And not only the yoga stretches, but also like the meditative breathing or the breathing exercises that you've done, and all sorts of movement, helps release stress in the body. And when you release stress in the body, it helps release stress in the mind. Is that right, Marianne?
Yes, because body and mind are connected. And the other way around, because if you offload your mind, then your body also will not hold on or not remember in the cells what you were thinking. So it's like the infinity sign. Body and mind are connected. Yeah.
And thank you for a wonderful presentation. I think going and talking about mental health is quite a heavy topic, and a topic that some people are still not sure about how to talk about, what to do. But I think you've given us a great idea of looking at things like looking at our triggers, trying to see how we can identify stress through our thoughts and our body, giving us some tools to actually look at our thoughts and actually question whether they are, whether we need to make them valid, or whether they are irrational thoughts, which we need to then move away, and actually giving us something physical that we can do to help release stress. I think a lot of the participants have found it useful. So thank you very much for your time.
You're welcome. Anytime. Yeah.
I thank you all the participants who joined. I would like to end the presentation with saying that please, can you, Nicholas is just going to put up the poster for the KAPD. Please do think about joining KAPD. The more members we have, you know, the bigger the organization and a lot more that we can do. As you can see, I mean, pediatric dentistry is a huge part of a lot of the dentistry that everyone does. So I think, and there's a lot more that we can do with more members. So please join. And I think we are going to just screen share right now. I'm going to ask to end this webinar. I'm going to ask Marianne if she doesn't mind just for a couple of minutes, just repeating the breathing exercise so everyone can remember it and leave the webinar feeling less stressed and more refreshed.
Of course, I'm back. Yes, I can do that. So yeah, just sit comfortably, because that's also very important. Just make sure that you're sitting comfortably, and put your feet on the floor if possible, because connection with earth, to ground yourself, is also very important when it comes to stress, to feel that you are here, that you feel that you are in your body, because that's important. A lot of times when we experience stress, we fly out of your body, and to do, for example, this breathing exercise brings you really back into your body. So I want you to close your eyes, and I want you to breathe in and count 5 seconds on your breath in your inhale, and 5 seconds on your breath in your exhale. Just focus on your breath and become aware of how your body feels. So while you're breathing in and out, I want you to put your hands on your heart. I want you to feel how your chest is moving up and down when you are inhaling and exhaling. And while you are making connection with your heart, I want you to think of somebody or someone or something that you love very much. And I want you to connect to that love. Just feel this love all around you in your body. Maybe you get a picture of that person or that something. Just see how it looks like. And connect to that feeling of love. And when you feel that this love is flowing through your body, I want you to breathe in and breathe out through your heart. That you actually can feel that the breath is supporting you, because the breath is always there to support you. Something you can always count on. You feel, while you are breathing through your heart, how the love can expand through your body, how compassion can come in, and actually this love can also radiate to the outside. So you can feel how the breath is calming you. When you are ready, you can open your eyes again to come back to the room that you are sitting in, and to take a look around you who's there, and to keep connected to the love that you feel inside of you. Because, you know, open hearts see love everywhere, and if it comes to connection, it's all about love, always. So be kind to yourself. Please be kind to yourself as you are doing the great work that you do. And thank you for having me. This is my big honor. And stay healthy, both physically as mentally.
Thank you very much. Marianne, thank you. Thank you very much, Dr. Shah. You've done a fantastic job in taking us through this. This was actually our baby, Dr. Shah. This topic on mental stress is something that has been clearly on both of our minds. And I'm really glad we managed to do this. A few announcements. First, just before we close, hopefully we still have the mood that Marianne has put us in. We can appreciate some of us who are here. We have Professor Kemoli. Professor Kemoli has been an anchor to this association. And amongst others, we have Dr. Gishu and Dr. Kere, who are part of the council, and Dr. Ireri. So without them, this would not have happened. Then we also have Dr. Kibosi and Dr. Rop. They're from Moi University, and they're also comrades in this association in terms of taking care of children. Thank you so much, Dr. Musera, as well. She is part of us. Dr. Kasami is also with us. And we also have Dr. Bat. Dr. Bat is a part of the University of Nairobi, and she's in the maxillofacial team. So we shouldn't think that we can just stick to our little corners. We do not have to be pediatric dentists to be here. And let's get into this mode of sharing, especially about COVID-19. This is something that's hitting us all in very hard ways, especially when we're talking about mental stress. Thank you also, Dr. Rose Nganga is also with us. She's also part of the pediatric team. We don't want to forget her. Next week, we shall be having a webinar about MyoBrace. It was on last week, and we have part 2 of it. We shall be talking about patient evaluation and diagnosis of MyoBrace. And in addition to that, hopefully a lot of question and answers and interactive session. We trust that it will be on Thursday next week. The link should be posted early enough. And the following week, we have a very interesting topic. We'll be discussing dentistry as a business during the COVID-19 pandemic. And that link will also be posted early. Please join in. We have had very good numbers today. We've had about 170, between 170 and 180 coming on and off. I hope it's because of the internet and not because of giving up on the talk. So let us see if we can continue these conversations next week and the week following. So just to finish off, in Marianne's tone of voice, stress should be out the window as much as we can have it. If you need a reminder, look at the photograph that I have posted for this webinar. Hopefully it will calm everyone down. Otherwise, we shall see you next week and hopefully more members to join us. Thank you and God bless.